slowdown in vaccines, but an uptick in testing for the virus. State health officials are trying to avoid another surge. But with less people seeking the vaccine, NewsChannel 8's Jamison Keefover finds out there's one group in particular that health officials are calling to set an appointment. Jamison?
Yes, Kim. Testing was down last month in March, and people were only getting tests just out of necessity for business and for travel. But now people giving COVID-19 tests are seeing their appointments filled, and they're finding positive cases in the community, specifically in younger Oklahomans. The vaccine rollout moved quickly through older age groups and is now open to all adults, including some teenagers. But access doesn't seem to be the reason Oklahoma is seeing less people take the shot.
Now we're moving into groups that I think are naturally less inclined to get a vaccine, and that's your, young adult populations.
According to the State Department of Health, so far less than 20% of people under 35 have received the vaccine. With many cities relaxing COVID restrictions, the slowdown in vaccinations has officials concerned.
If we don't take advantage of this time to finish getting everyone vaccinated, then we might have issues with increasing numbers again.
And I know there's less concern among that group because there's not as much of a risk to them, but I would urge them to understand they're such an important part of breaking the transmission of COVID.
The lack of urgency is also being seen when it comes to testing.
Our testing numbers have fallen some in the state as well.
A Tulsa lab where testing became almost non-existent has now picked up some new clients.
Our rates of testing for symptomatic people have gone up quite a bit, and we have had almost 4 positive tests within this week, and that was going for probably more than 3 weeks without a positive test. A lot of the people who have been symptomatic and the people that I've tested who have tested positive have been in that younger age range.
Other states are already seeing a rise in positive cases. Health officials fear Oklahoma could be next if people quit mitigation efforts too quickly.
I do believe that really testing is central. It's just as important as wearing a mask or getting vaccinated in order to control the spread of COVID within the community.
There's been a shift from testing to vaccines in the state. A lot of those resources moving away from those pop-up testing sites we used to see now into getting as many shots as they can into arms. But health officials remind us that we need every tool in our toolbox to get past this. Live from Lookout Mountain, Jamison Keefover, News Channel 8.